But only about 10% of men with erectile problems are actually going to show up at their doctor's door. And they're usually dragged there by their wives. So 90% never seek care, which is too bad. And these are men that are over 45 years of age. Why don't they come? Because they think, well, maybe sex isn't important, or it's not important to my partner. They can't face telling anybody about it. It's not causing any conflict, so we'll just let it go. And that's okay. If it's not a big issue in your life, it's not causing you distress, that's fine. But I know a lot of men it is causing distress, but they don't want to take the step to go to the doctor. They actually are worried that maybe this is prostate cancer or something else, which, by the way, there's no link. Or they're unaware of any potential treatments. They just figure they have to live with it, or it's only temporary. That's what they're thinking. Or they have negative perceptions of the treatments, like the treatments are going to cause me harm in some way, or their relationship is, or the partner's not really caring. There's lots of reasons why men don't come. But you should go if you're still interested in being sexual. He's going to take a medical history. He's going to do a sexual health assessment, he or she. There may or may not be a physical exam, but usually there is, including a rectal exam. And there may be some blood work, maybe not, or specialized testing. So, if you've got erectile dysfunctions, what do you know about treatments? You've got to modify your risk factors. If you're 45 years of age and you're overweight and you're a smoker and you get fit and you lose that visceral fat, your erections will probably improve. But if you've been a 50-year pack smoker and you're 80 and you quit smoking, it's probably too late. You've already damaged your endothelium irreversibly. There's counseling, there's oral medication, local therapies and surgical, which I'll talk about. But stop smoking and talk about this with your partner. A little bit of alcohol is great. A lot of alcohol, forget it. Follow a healthy diet and exercise regularly. So what are the treatments we've got? We've got what are called phosphodiesterase 5 inhibitors, PDE5 inhibitors, Viagra, Levitra, Cialis. And Viagra and Levitra are somewhat similar. They're all the same class of drugs. They all work the same way. They enhance your erection. They don't give you an erection, they enhance it. So by taking a pill and watching very slow, boring golf is not going to give you an erection. You have to be sexually aroused, and that's really critical for these things. And within 30 to 60 minutes, you should get an erection, especially if you haven't had a high-fat meal. Where Cialis, it doesn't really matter about the food. And the Viagra Levitra lasts 4 to 5 hours, whereas Cialis will last a lot longer. So some people prefer this because it's more spontaneous. Other people just want to take the medicine when they want an erection. Headache, flushing, nasal congestion, these are some of the common side effects. But in all my years of practice, since 1998 when Viagra came out, I don't see many men quitting these pills. Take about an hour. Make sure that you optimize it. Make sure there's enough stimulation, and do so in a relaxed atmosphere, okay? Don't set yourself up for failure. And I encourage men to try this on their own with self-stimulation. What happens? How long does it take? Do you get any side effects? Figure it out before you're with a partner. And if it doesn't work the first time, you must keep trying. You should probably try them 2 to 3 to even 4 times before you say that they're not working. Is this going to kill you? No. These drugs are very safe, okay? And this is a misconception that's been out there. There is no increased incidence in MI, stroke, or any cardiovascular event on these drugs. Matter of fact, these drugs are probably going to help the endothelium, and there's some animal studies demonstrating that. So they're very safe. But if they don't work, we can actually put a drug directly into the penis to cause those smooth muscles to relax. Even if you're not aroused, it'll cause them to be relaxed. Within about 5 to 10 minutes, lasts about an hour. So injections work very well, especially on people that have had some nerve damage, so the signals can't come down from the brain. Or we can use something that's not drugs at all, just mechanical. We can put a vacuum device on, draws blood into the penis, and we maintain the erection by putting a band at the base. So these work very well, these vacuum erection devices. Last but not least, if everything fails, all the reversible methods fail, we can go to see Larry, and he and his colleagues can go and put in a penile prosthesis, which are much, much better than they were when I started 20 years ago. So what are your options then? Modify your lifestyle, get some support, get some whatever. Get control of your chronic disease. If that doesn't work, then try initiating with some of the PDE5 inhibitors, as long as they're not contraindicated. The contraindication is being on nitrates. If you have angina and chest pain and you're on nitrates, you can't take the PDE5s with them because it'll drop your blood pressure. If it's still a concern and you still don't have success, you can try the injections or the vacuum device. And if that still doesn't work, then you can look at implantation. But ED treatments are successful in most patients. In most patients, the pills will work. Somewhere between 50 and 80% of the time they'll work. The second-line therapies are successful in 90% of the patients, and only 1% need to go to this surgery. So, a short recap. Changes to sexuality are inevitable. They can be minor or they can be major, but you do not have to alter your quality of life if you take care of your health, you seek medical attention, and you remain positive. We've heard a lot of negative here, but could be positive. Your sexual life could be very positive. ED is very common, and it's highly treatable. It's a marker for cardiovascular disease, and other sexual dysfunctions can be successfully treated medically or with individual or relationship talk therapy. And treatments for sexual dysfunction will enhance your quality of life, and they're generally safe and well tolerated. Thank you.